So what if I told you there's a diabetes medication that not only lowers your blood sugar, but also protects your heart and kidneys, even if you don't have diabetes? Hi, my name is Quick. I'm a pharmacist. And for the next few minutes, I'll be reviewing the medication Dapagliflozin, better known by the brand name Farxiga. I'll cover what it is, how it works, how to take it, side effects, and some important safety tips and best practices that I believe you should be aware of. So let's start with the basics. What is dapagliflozin? Now, dapagliflozin belongs to a relatively newer class of medications called SGLT2 inhibitors. Now, I'll explain what that is in just a second. Now, dapagliflozin is approved for the management of type 2 diabetes, for the management of heart failure with reduced ejection fraction, and in the management of chronic kidney disease to help protect kidney function. Now let's talk about how dapagliflozin works. Now to understand how it works, we need to talk about your kidneys. Now your kidneys function basically as filters that clean your blood. They filter huge amounts of blood daily and decide what to keep and what to get rid of through urine. Now normally when glucose or sugar passes through the kidneys, almost all of it gets reabsorbed back into the bloodstream. Your body doesn't want to waste what it deems as a valuable energy source. So there's a special transporter called the SGLT2 that pulls glucose back into your blood. Now, obviously, if you are diabetic, that's the last thing that you want, more sugar being dumped back into your bloodstream. Now, this is where dapagliflozin comes in. It works by blocking this SGLT2 transporter. Now, when this transporter is blocked, glucose cannot be reabsorbed, so it gets eliminated from your body through your urine instead. So, simply put, dapagliflozin causes you to urinate out excess glucose, which helps to lower your blood sugar levels. Now, the good thing about it is that this process also causes you to lose some water and sodium along with glucose, which helps reduce the workload on the heart. Hence, it's used in the management of heart failure. Let's talk about how to take it. So, dapagliflozin comes as oral tablets in 5 and 10 milligram strengths. For most people with diabetes, the typical dose is 10 milligrams once a day. For heart failure or kidney disease, your doctor will determine the appropriate dose based on your specific condition. Now, many people prefer to take it in the morning because dapagliflozin won't increase your urination, and you probably don't want to be getting up multiple times during the night to use the bathroom. So most people tend to skew towards a morning dose. Now, let's talk about some important safety information and best practices that you need to know about dapagliflozin. First, kidney function is crucial. Your doctor will check your kidney function before starting dapagliflozin and periodically while you're taking it. Now, I know this can be confusing sometimes because this medication is used in the management of kidney disease. However, there are warnings about kidney function. Well, here's the deal. In order for you to benefit from its kidney protective functions, there has to be a baseline level of kidney activity or kidney function. If you go below that baseline, then at that point, the benefit may not necessarily outweigh the risk. Hence, you and your doctor may have to go back to the drawing board to figure things out. So if your kidney function declines significantly, you may need to stop the medication, for some people temporarily and for some people completely, and another medication sought for you that will be better for you in that situation. Now, because dapagliflozin increases urination, dehydration is also a real concern. Make sure you're making a conscious effort to stay hydrated, but be mindful of any fluid restrictions if you're a heart failure patient. Dapagliflozin can also increase your risk for urinary tract infections and yeast infections, particularly in women. Now, if you think about it, the extra glucose in your urine, creates a conducive environment, or it provides food for yeast to grow, hence the increased risk. So tell your doctor if you have a history of frequent urinary tract infections, yeast infections, or if you are uncircumcised, as this increases your infection risk. So good hydration and general best hygiene practices can help mitigate some of this. Now, if you're taking blood pressure medications, your doctor may need to adjust them since dapagliflozin can lower blood pressure in some instances. This is usually a good thing, but it means that monitoring your blood pressure is very important, at least at the beginning of the medication or when the doses are changed. Now, if you're pregnant or planning to become pregnant, or if you're breastfeeding, dapagliflozin is generally not recommended, so make sure to discuss your family planning with your doctor. Also, limit alcohol consumption, as alcohol combined with dapagliflozin can increase the risk of dehydration and other complications. Now let's talk about some common side effects. Now, most side effects are related to how the medication works. And this include what we've talked about already: urinary tract infections, yeast infections, especially in women. Now, to mitigate this, drinking plenty of water and practicing good hygiene. For women, wiping from the front to the back and urinating after sexual activity can help sometimes prevent some of these infections. There's also reports of increased thirst and urination. Also reports of dizziness when standing up due to mild dehydration or blood pressure changes. Now, best practice is to change position slowly, sit on the edge of the bed for a moment before standing up, just to make sure that you get your feet or your balance so you prevent falls. There's also been reports of stuffy or runny nose, sore throat, and for some people, leg or arm pain, and even in some instances, constipation. Most of these side effects are generally mild and go away as your body gets used to the medication. Now, let's talk about some serious side effects. Now, while serious side effects are uncommon, obviously it's crucial to know what to watch out for. And the first one I'm going to highlight is something called ketoacidosis, which is a rare but serious condition that can occur with SGLT2 inhibitors, even when blood sugar isn't extremely high. Now, signs include nausea, vomiting, stomach pain, trouble breathing, or a fruity smelling breath. This generally requires immediate medical attention. There's also been reports of severe kidney problems, especially if you become dehydrated. So contact your doctor if you notice any swelling in your legs or feet, any changes in urination pattern, or any unusual fatigue. If you experience any of these severe or persistent symptoms, please don't hesitate to talk to your doctor. It may not be anything, but you rather want to be safe than sorry. I sincerely hope you found some value in this breakdown of Dapagliflozin. If you did, please give it a thumbs up. It helps my channel reach more people. And as always, stay blessed, and I'll catch you on the next video. Thank you.